Okay, good afternoon all. My name's Lindsay Pike and I'm from RIPFA, and I'd like to welcome you to this webinar on making the learning from safeguarding adults reviews accessible through a national library. May I just check that you can all hear me? If you could write in the chat box and just confirm that it's nice and clear and loud, that'd be really helpful. So I'm co-presenting with Sheila from SCIE here. Let's introduce yourself, Sheila.
Good morning, everyone. I'm Sheila Fish from SCIE, Head of Learning Together, and working with Lindsay and RIPFA on this SARS library project.
Great. So I'll just start by asking you to bear with me as well, please, because I use a breathing technique to manage a stammer. I think the chat box might not be working right now, so we're just checking that out. But thank you for being creative with your responses there about letting me know that you can hear us. I'll just mention too, I use a breathing technique to manage a stammer, so please bear with me. So this is us. And this webinar will last for 1 hour, and you will be able to communicate with us by using the chat box really soon. We're just working on that now. Excellent. Now it's working. Wonderful news. Great. So this webinar is a much shortened version of 2 day-long workshops that we held in the last few weeks, and we really wanted to sort of propose what a national library could look like and do through those workshops, and we'll be drawing on the feedback that we gained during this webinar, and we'll be asking for your feedback too. So the main aims are to briefly explain what the SAR library project is planning on doing, broadly speaking, to seek your feedback on what that should look like in practice, to introduce a proposal to make the library focus on systems learning, which we'll be explaining in more detail, and to just briefly touch on one other aspect of the work, which is on the SAR quality markers. So may I start by asking you to just fill in a poll, which Steve is just bringing up on screen now, just to let us know your rough job role. So if we could just bring up that poll, and open it. So yeah, please just maybe make that slightly larger as well, Steve. So yeah, just click where you are. Yeah, which job role is nearest to your own role, and do write in any others that we've not quite managed to capture. So looks like we've got lots of people from boards, which is really, really helpful. That's great news. A few from social care as well. Some NHS leads, which is wonderful. No one from housing, I don't think yet. No care providers yet, and some training providers too. And yeah, we've got a few people that we've not managed to capture with those broad categories either. So sorry about that. And yeah, we've got delegates from Warrington, our most northern, I think, colleagues here, down to the Isle of Wight as well. So a nice broad spread geographically speaking as well. Brilliant. Okay, so we can close that poll now. Many thanks, Steve. Right, so just really briefly then, if we can close that poll, I'd like to just briefly sort of give you an idea of the library projects much more broadly speaking. So we were really pleased to be commissioned by the Department of Health in March or so to start working on a 1-year project, and we really wanted to like build on the previous work which has been done, both by researchers like Jill Manthorpe and Susie Bray and Mykel Preston shoot, but also the regional work that many of the ADAS safeguarding regions have started to sort of gauge what the SARS look like within their regions and create a regional repository of SARS there. We also recognise that there's been a pretty sort of long-standing demand to create a national library of SARS-2. So we've seen it as pretty good news that we've got this small level of funding which RIPFA and SCIE are jointly working on. So the library is just sort of one part of that broader project, but that's what this webinar will mainly be focused on today. And the broader project is split into 2 main themes. So one theme is looking at the quality of SARS which are being carried out, and sort of and adapting the SCIE serious case review quality markers to the adult context is just one part of that work, and the other part is thinking through how we can make the learning from SARS used better, and the library is just one part of that, and we're also looking at creating one kind of national space where we can signpost to the sort of vast range of research, thematic research and regional work too, which has been done, and we'll be carrying out a one-off collation of the issues raised within SARS and the quality of SARS too. So yeah, we're really pleased to be sort of starting off this work, which will be trying to create a kind of a virtuous circle really, whereby like as the quality of SARS reports goes up, they become more and more broadly used, and practice gets better and better too. So I'd like to pass over to Sheila now, who will take you through the next step.
Indeed. Judy, before we go, there are a couple of comments on Catherine's asked the level of funding. I don't think it's a secret. We've got £30,000 between the two organisations to do what we can for that in this first year. It is a one-year project. There isn't any guarantee at all of funding to follow it, and I think, being honest, mission creep is a constant headache really for us in this work. But it is why we tried to include in the proposal things that we could do that built on public money that's been invested by other means, like the quality markers, which were developed between SCIE and NSPCC using DFE money through the innovation programme. And we hope that part of, as important as doing what we do within the year, we'll be coming up with a proposal and working with key stakeholders to work out what is it that what's most important that we need as a phase 2, and together to see if there is any possibility to finding some funding to enable that, because clearly, especially with the library, to do it just as a one-off isn't going to be very useful in the longer term. So that was the money. Does that help, Catherine? And from Catherine again, there was another question about whether the library will include SARs that don't involve an independent chair. I think we'll pick up on that when we talk a bit more about focusing on the learning, but on principle, yeah, we're agnostic about whether there's an independent chair or not. The learning that comes out of something that's legally called a SAR with an independent chair isn't intrinsically better or more useful than a learning review otherwise badged. So I think we would welcome an open a broader church in terms of reviews. I think it gets more difficult where what we're not offering to do is include DHRs and other statutory reviews in the library, because they come with such different policies, frameworks and requirements that it's quite hard to get. It would be quite hard to get any commonality in the coding and categorizing that is needed to make these things searchable. Great. So we wanted to check, of that overview of the project, as Lindsay said, 2 strands supporting the quality of individual SARs as well as supporting the use more broadly of SARs. Are there any questions people have just on that, the project as a whole, very briefly, before we move on to the detail of the library? There isn't a proposal. There is a question about a desire to establish training for SAR authors. On the back of the quality markers, which we'll say a bit more at the end of the hour, it would make sense for there to be some training to support the quality. I guess for reviewers, but as much for commissioners, we'd probably argue. Again, there's no funding behind that, so it probably would be a commercial offer rather than something that through this is provided free of charge. Well, the review include terms of reference. The library would include terms of reference if they're in the reports at the moment, but not specifically gathering terms of reference separately to the SAR reports. Shirley is asking about the involvement of SAR authors. That was one of the messages that a feedback point we've taken from the earlier workshops, that having done this initial engagement with anybody who is interested really, but a lot from board chairs and board managers and safeguarding leads across different agencies, the next step, we agree, needs to be working with a group of reviewers to check that our proposals, that you'll hear more about in the next hour, would work for experienced reviewers in the field of adult safeguarding as well. So yes, there is a plan. There's no detail as yet, Shirley, but we'll share that soon, to get together a small workshop equivalent of active SAR authors, reviewers, to input into the setup phase as well. Yes. Yes, Joanne's asking about the criteria. It is one of the things we're going to come on to cover in this session. Okay, thank you, Catherine. And we'll pick up some of the comments as we go, and some we will pick up after the hour and chew on them as we take the work forward. Are people happy I move on? I'm going to move on to the overview of the project, to thinking most specifically about the library of SAR reports that we've circled there. Is that? Oh, this one. Right, onto the SARS library itself. At its most basic, effectively what we've offered to do is to gather all SAR reports into one virtual place, but clearly that's going to be of limited use. So the next phase will be working on how we make them searchable. But before we go very far with that, it makes most sense, and it's the good principles of good user-centered design, to actually work with the users of that library to check our assumptions about how the library is going to be used and what functions you hope it's going to have. Because as Lindsay said, there's been a sort of steady clamour really for the need for a library to bring all SAR reports together. Even before SARS were SARS and still SCRs, there's been steady demand for people saying it would be helpful. But for our purposes, it would be really useful to hear from you a bit more about that. About how do you think that this library of SAR reports could actually help you? So our question really is, thinking of you in your role, what are the ways that you think a library would be able to help you? Sorry, I'm struggling with moving on to the next one. So our question is exactly, what is your role? What would you like the library? What would you like to use the library to do? We've got some working assumptions in our heads. So you might be, as the example on the side there, you might be the chair of a SAR subgroup of your board, and your board chair has just agreed with the proposal of the recommendation of your subgroup for a decision to conduct a SAR on a certain case, and your job is to do some kind of initial scoping. So I as the imaginary chair of that subgroup, might go to the library to see what other SARs have been conducted nationally on similar circumstances to the case that I'm dealing with. And because I might want to look at what kind of learning has come out of SARs conducted on similar cases, so that I can scope my particular commission to be proportionate in terms of building on what others have learned, rather than starting from scratch and duplicating learning that's been had elsewhere. So that's one possible example. What we're asking you to do is use the chat box to give us a few ideas about how you think this library of SAR reports might help you. What would you use it for? What task would it help you to accomplish? I'll do a bit of a scan as people add things there.
Yeah, we've got some really good comments flying through really quickly, so it's quite hard to keep up with them. Just to mention too that we will do our best to keep up with any questions while they're coming through, but we'll go back through all the text of the chat box post webinar and just and send out any other replies that we've missed. So yeah, apologies about those.
Nice example from Luke there of using it sort of actually to inform sort of strategic improvement work. So if you're about to start a bit of work locally on improving use of the Mental Capacity Act, you might look to the SARS library to see what learning has come up. You might be able to do a bit of a, health check. Are the problems that other SARs have identified happening in my locality or not? Yeah, I think that's a really nice idea.
Oh yeah, and Rosie's mentioned that sort of creating a central space to put things like guidance or templates or documents from the boards would be really helpful too. We've got the Knowledge Hub from VLG. I don't know if that's still being used, but that's the main space, I think, to do that kind of local practice sharing. But we might be able to look at that as a stage 2 of this project. It probably won't come within scope here just because of the volume of but yeah, we can
Indeed
think about that.
It's a nice example there about just the flexibility of the word library. So at its most restricted, we're talking about the SARS library as literally just the gathering together in one space of individual SAR reports. And in the broader sense, we're having a sort of website and broader resources, which might include exactly those kind of sharing of more SAR process tools and supports. I think all of these very interesting examples, I think we can't go through all the detail here, but some of them are similar to examples that people brought up on the workshops. And one of the issues that we ended up discussing in the workshops was the fact that having SAR reports all gathered in one place doesn't, at the moment, they're not going to be quality assured in any way. So if people are looking for, I don't know, how have people set up the terms of reference of a review for a certain sort of scenario? You won't know from the report whether the way they did it, they ended up feeling was helpful, was good, worked, or whether they would never do that, approach it in the same way again. There's not going to be any moderation of that, what's good or what's not good, which I think does have an effect on how accessing the library can be useful. So the library might give you lots of examples, it might feed you with ideas, but it won't necessarily tell you what good is. That it won't take the need for that judgment away from the people accessing the library as yet. And again, there are lots of things where if we're just looking at the SAR report, Catherine's brought up the question about the so what, whether the SAR has made any difference, whether the findings, the learning and the action, the report itself isn't going to capture necessarily the actions that the board has taken in response or member agencies, let alone any evaluation about whether it's been effective. So again, you start to see kind of restrictions on what the SAR report itself can give and what other things, again, we might want to think that we might want to consider including in the broader library, but that the SAR reports themselves wouldn't give you. Okay, thank you. I think we're going to move on to the next bit, but it's useful to see the different ways that the library can help kind of commissioners' reviews in SAR roles, potentially reviewers in terms of they're seeing what learning has come out of similar reviews. They'll be able to provide examples in their own reports of if similar findings have been found elsewhere, and trainers might look to the SAR library to inform the development of their training programs, as well as more strategic improvement work. But again, I think it's always going to be important to not to see the learning we get from SARS in a broader context of evidence to support improvement and effectiveness, that we wouldn't want to end up with good practice only being determined on the basis of the learning comes out of SARS, because clearly that's only one part of an evidence base for good and improving safeguarding work.
Great. Okay, so we'll move on now, and we wanted to just talk you through the practicalities of the way that the library might work, just because I think that would probably go some way to answering quite a few questions too. Within these 2 full-day workshops, the consensus was that the best way to go about this would be to ask either the boards or the chairs or the authors to complete a cover sheet when a SAR is published, which categorises the SAR on numerous dimensions, and that would mean that we would be creating a searchable library where you could go in and sort of check out which SARs have been completed on on self-neglect or on mate crime or with people with dementia being the sort of main subjects. So I just wanted to sort of speak through what that might look like and what those dimensions might be too, because making sure that we're collecting all of the right stuff to start off with will make the library much stronger. So we've built in numerous stages of consultation. We've been through draft 1 and noticed some, gaps, and we'd like to do a much broader consultation of draft 2 of the cover sheet, which we will detail shortly. So there's sort of 3 main types of data that we'd like to categorize by, plus the learning, which Sheila will go into in more detail shortly. So the 3 main sort of groups of data are the administrative data, the characteristics of the SCIE process, which both are looking at the ways that SCIEs are being carried out, and then lastly the case characteristics too. So just to sort of provide you some examples of those. So the administrative data would be things like the commissioning board, the name of the case, whether the SCIE was published or not, and the reasons why, plus some key dates too. So the date that the referral was brought in, the date it was recommended to the chair, and the date of completion too. And the reason why we thought those dates would be worthwhile is because we'd be able to know what the average time is from referral to the author, being commissioned, or whether there's one region whereby that process works much more quickly and smoothly, and why might that be. So by checking out those kind of things, it sort of provides scope to learn from other regions and also to see patterns being sort of made. So the next sort of type of data is the process characteristics. So the criteria met, so why the SCIE is being carried out, like whether any parallel reviews are being conducted, like DHRs, the method and the size of the SCIE, whether the person and/or their family were part of it too, and whether there were any significant challenges within the process. And lastly, the case characteristics would be looking at those things that the thematic reviews normally bring up. So the protected characteristics of the person, their age, their sex, what kind of safeguarding issue is being discussed, the location, those types of things. So we are starting out with the idea that we want to ask more questions than less, and then sort of narrow it down in the future once we realise which questions are most crucial, because we think this provides a really great opportunity to provide pretty sort of straightforward but really helpful data that the sector can access without needing to wait for researchers to do those thematic reviews too.
That speaks to some of the questions that people are asking, or comments on the chat bar. Those details that Lindsay's covered, some of the SAR process, we agree would definitely pick up. Under what criteria are they SARs, and including, are they legally SARs but the elective ones, not because they've met the other criteria? It would pick up, we'd be able to get some basic stats about whether, if the person is still alive, they were involved, and or their family or carers. It would be able to give us, if we, very sort of basic data, but that we could, without much effort and very little extra cost, get regional and national overviews about what the activity, what we're doing and how we're doing it in these different areas, which I think some of your comments are agreeing with us would be helpful to do.
Great.
Someone's asked a question about publication. Our work on this library is assuming that the library would be publicly accessible and be mainly populated on published reports as a starting assumption, but we're going to come on to talking about the learning now, and I think we want to explore, we hope that there will be a possibility for the learning to be shared with the library, even if a full report wasn't, or it wasn't possible to, for whatever confidentiality and sensitivity reasons, not publish a full report, but have the learning in suitably anonymised form feed into the library anyway. But those are exactly the kinds of things that we are going to be working out as we go along in this process. But there is an assumption that even though there's no requirement in the Care Act to publish, a lot of people are, and this kind of library would need to sort of work on the assumption that we're dealing predominantly with published reports.
Great. Moving on. Brought up on screen now is a draft of what the case of the cover notes might look like. You can't read all of that clearly, but yeah, those categories are the ones I've just spoken through. Like I mentioned, we will be consulting on the next draft of that, and we'd like to send you all out the details of that after the webinar, but please do let us know if you'd rather not be on that mailing list. So I think people have been commenting while I've been talking, but please do add any other sort of other dimensions or categories that you would want to see as kind of searchable dimensions in the library. I've not been through all of them because it would be really dull to do that for you. but yeah, do just note those down, and we'll make sure we go back through these notes to create our next draft. And I've noticed there's been a question about freedom of information requests. I'm not exactly sure what you mean by that, because it would presumably be the board that would get those, because we aren't creating the content of the SAR reports. But please do tell me what you, whether I've missed a point there. Thank you. Great, so I'll pass over again to Sheila. Wonderful. And we're gonna talk through the learning bit next.
Exactly, and just having a quick scan of the points you're noting, I think you'll find it's looking like you're on similar lines to the first iteration that we've done, which is great. And as Lindsay said, we'll send that out so you can comment in more detail. And we're assuming that all of this we'll be aiming to find ways to complete this cover sheet that are as least time demanding as possible. So we'd expect it to be some online thing, not a hard copy, and that you could progressively complete as you went along, rather than having to save it all up to become a massive job at the end. So, as Lindsay said, we've got thinking of what we'd like to categorize, decode in the SCIE reports that we gather into this library. There's going to be some that's about the administrative process, some about the SCIE process, and some about the case characteristics. Now we want to move on to thinking about the actual learning that's contained, hopefully, within these SCIE reports. I think I have to kind of rewind first to start this. When we're thinking about libraries, clearly we did quite a lot of background research to look at similar efforts that have been done in other sectors, and particularly the children's world has their own repository for serious case reviews. And when we were thinking about the learning, we looked at that model, and it became quite, one of the features of it is that the library of SCR reports only gives you access to the whole report. It doesn't allow you to go into the report in any more detail than that. So, for example, if you go into the SCR repository and you search for domestic violence or domestic abuse, you will get a whole long list of all the SCRs that feature domestic abuse in some fashion. But it doesn't give you any more fine-grained detail than that. So in some ways, the use in that respect is quite limited. To supplement that, therefore, there are more thematic briefings that NSPCC does, which are very useful. But you can't do that yourself directly with the library. So with that in the background as kind of food for thought, we started thinking about whether it would be useful in setting up this SARS library to think about how we might go beyond giving people access to the whole reports to actually giving people access into the reports, to the specific learning points captured within the reports. And that obviously led us to think about what kind of learning do we mean and how would we access it. Does that make sense? Give me a few thumbs up or wave of your hands if you're with me. Really getting beyond just telling you which full reports are relevant to your topic of interest. Thank you, Shirley. To being more fine-grained in terms of being able to find the learning within the reports that's relevant to your interest. So, thinking about learning, it might seem self-evident what we mean by learning, but terminology in this field is, I would just say, blatantly a nightmare. We all tend to use the phrase learning in all sorts of different ways, meaning often different things, but often we don't realise when we're saying the same thing but meaning something different. So we've come up with 3 different types of learning that we're using different labels for so that we can differentiate between them. One of them is, one type of learning that is important that you get from SARS is what we call case findings, which are judgments about the handling of the case that's being reviewed. So the normal learning that we're most used to, I think, identifying what did the professionals who worked with the person concerned do well, and where was practice poor. That's one kind of important learning that comes from SARS, and we're calling that case findings. A second kind of learning that you can get from reports goes beyond the case findings to identify explanations of why things happened in the way they did in the case, and extract what we've called systems findings that are actually generalizable beyond the particular case. So what are we learning about the enablers or the barriers to good practice? What are the things getting in the way? Why do people not do what they should have done, etc.? So it's really that slightly deeper level of analysis of what's causing people to do either good or poor. That's the second type of learning that you can find within a SCIE. And the third type of learning, which again is slightly different, but we do tend to call it learning, are the recommendations or questions for consideration, depending on whatever model is used, that come out of the systems findings. And that third type of learning really focuses on what to do. Ideally, we hope to tackle the systems findings and minimize the recurrence of similar issues in future cases. So we've distinguished, if we're thinking about, through this library, giving library users access into SCIE reports to actually be able to access the learning, we think it's important that we intellectually distinguish these three types of learning. And our proposal is that the library should give you access to the middle one, to systems findings. Brilliant. So the library should let you see what light are SCIEs shedding on what's causing practitioners not to deliver the service, the quality of service that we all aspire to, probably them as well. And equally looking at the good practice. What are we learning, not about just what we're doing well or what we're doing badly, but what's helping people do good practice and what's getting in the way of good practice. So really targeting the causal issues. And the reason that we think that's important, and we put the MB, that's model neutral, because it doesn't assume any particular model. You can use any approach, any model, it's not restricted, to get to that slightly deeper level of analysis about what's causing things to go wrong. So root cause analysis does it. Any systems-based approach, whether explicitly or implicitly, can do this. But we think it's important because it's those systems findings that are most useful to improvement work. If the purpose, an important purpose of SCIEs is to inform improvement work and to actually help changes in practice for the better, then it's really useful for SCIEs to give us an in-depth understanding of not only the strengths and weaknesses of contemporary safeguarding practice, but also their causes. Because if we know the causal things, we can better target our improvement work to make a difference on the ground. Does that make sense for people? At least a few. Thank you. So, if you're going with me in that respect, we think that the SCIEs library could usefully give people access not only at a high level to saying this report or that report or this list of reports are relevant to your topic, let's say. I'm interested in what learnings come out of fire deaths. I don't want to be given just 15 reports that have featured death by fire. I actually want to know what the learning is, and I might want to know what learning is relevant to me as a housing provider, as distinct from me as, I don't know, a GP. Yeah. So really trying to use the library to give people access to the learning within the reports, to code and categorize the learning within reports, and specifically to be able to do that around systems findings. That's the goal. We think that'll be useful because if we can get the library to do that, you won't need to wait for one-off analyses like the equivalent of the thematic briefings that the Children's Library does, or that Mykel, Preston Chute and Susie Bray have been doing on a regional level for London, for South West at the moment. Not denigrating their work at all, it's a very useful contribution, but inevitably by the nature of research, what they focus on might not be exactly what any of you participating in the webinar are interested in. So you could it would allow you to access the library directly via filters, searches, and interrogate it according to your particular needs at that time. And it would get away from the inevitable time lag that comes with doing a nice piece of research that makes it more out of date than if you could do it kind of in real time. And we think that a sort of exciting potential is that if we can establish a system for coding the systems findings within SCIE reports, in theory, the library could be updated almost in real time as each SCIE is completed, which again would give all of us in the community of people interested in adult safeguarding a more, of course it's not going to be absolutely real time, but a more real time than we've had up till now, overview about what learning is coming out of them, so that we can better use that in a lot broader range of people can better use the learning that's coming out of them. So some examples we've given on the next slide. So in principle with this proposal, you'd be able to identify learning on particular themes from reviews commissioned elsewhere. So sticking with my example of domestic violence and abuse, you could go in and see what's all the learning that's come out from SARS on domestic violence and abuse. If I was about to commission a SAR that featured DVA, I could use the learning that's already been identified from other SARs to inform my scoping. I might want to check if some of common learning points from other reviews featured in my locality, featured in this case and more broadly, but I wouldn't have to start from a completely blank sheet. I could focus the resources on a more targeted area where less was known, regionally or nationally. Or again, like we said earlier, we could use it as a basis for self-assessment. If you were thinking of if tackling domestic violence and abuse was a priority area for your SAB, it might be that you could use the learning identified through the SAR library to inform a basic self-assessment to better hone where your action would happen. And it could also be used to collate learning either regionally or nationally, to actually inform discussions about whether there are certain issues, again, barriers or enablers to good practice, that would be better tackled at a regional or a national level, rather than each locality trying to tackle them on their own. So again, it's a form of data to better inform what you do. And there'll probably some more from this morning. I'm just seeing some questions that surely scoping would need to be based on the case, but not only on the case. I think if you look at what's going to come out of the quality markers, that the scoping of a review, the quality markers in children, and I think it holds for adults, suggest need to be based on the case and your local context. You don't want to use a SAR to relearn what you already know. You don't want to use your scarce resources to relearn things about an area of practice there might already be a big improvement program focused on. So it's just about, it is case of course, but case and local context I think is the current thinking, both being important.
And I've just noticed there's a question on buy-in too. Just to mention, we've been liaising with the National Board Chairs Network and the National Safeguarding Leads Network. We've been in touch with the Board Managers Network too, and the Board Chairs Network have said that they support this work in principle, which is really, really helpful, because they've the London boards network did a piece of research recently and realised how hard it is to get the SARs from boards. So that's sort of made them really try to provide their support to us by really encouraging boards to send in their published SARs. So that's really helpful indeed.
Let's go on to the next one, because we're going to ask some questions.
Yeah.
So implicit in our proposal to focus on systems findings is that the audience for that kind of collation of that kind of learning is predominantly senior managers rather than frontline staff. It's not saying it's an either or. There's lots of ways that SARs can be used to inform training for practitioners, but the systems findings are most useful to inform more strategic improvement work, because lots of the barriers, things that are getting in the way of doing good, timely, quality help are usually not within the gift of practitioners to tackle, and at least some of it within the gift of managers and senior managers to do something about. Hence the logic of that kind of systems findings being more useful for people involved in more strategic improvement work. Good.
Great.
So, sorry, I keep missing the thing.
It's okay. So yeah, just some more.
So any basic questions, queries, concerns about that proposal of the focus on systems findings? We do have a detailed proposal of what that would look like in terms of categories and codes, but people in the workshop even said in a day it made their brains hurt, albeit in a good way. We didn't think we'd even try it in an hour webinar, but we will be, once we absorb the input we've had through the workshops and today in the webinar, we'll be sharing more broadly the next iteration of things, so then you'll see the coding of systems findings that we're proposing.
Yeah, and just to pick up on one other point, so some people were querying whether we'd be able to produce summaries of the SARs. We won't, but what we are trying to create instead is a sustainable method whereby this library won't need loads of our time, because we've not got the ongoing funding. We need to make sure that we create the process, which means that boards can categorize and upload their own SARs. There's no reason why they can't also upload the summaries that they create those. So yeah, that might work, but we won't be able to sort of do that work ourselves.
Indeed, and people are asking. A discussion started on the chat box about sustainability, and that's exactly, in a way, all of this. All the design work we're doing is trying to design the most sustainable system that could work without necessarily having a librarian. So it might need some more workshops and induction time and a bit of kind of quality control at the beginning. But the idea is that this could be a self-serving system where people pre-code and categorize the SARs as part of the process of submitting them to the library. And that's effectively what we'll be testing on this first bit, but is why that it's so important to do the collaboration and feedback on the codes and categories that are used. Shirley was asking if there's any national interest. I think it's fair to say that there isn't an obvious lead within the Department for Health, particularly now Claire Crawley has retired. But there is a lot of interest from LGA, the Chairs Network,
national
and nationally,
networks, which do link through to them as well. So that's good. Yeah.
So the last kind of question before we use our last 6 minutes, that proposal to focus on systems findings would require, and it links to the sustainability point, it would require a commonality to how learning is organised and presented that doesn't currently exist. And yet it would be necessary if we're to readily collate findings and be able to identify themes. So it raises a critical and very important issue about what the appetite is for a level of commonality across all SAR reports, regardless of what methodology they use. Because without it, we can't do any sustainable correlation of the learning that's coming out of them. So that was a question, and clearly the guidance, what's required of people in the CARE Act is very high level and broad and doesn't get to this level of detail. So at the moment, boards have complete freedom to construct SAR to look however you want it to look, and reviewers, depending on how tightly the SAR is commissioned, can craft a SAR to look however they like it to look, and finding can be defined however people fancy. To have any national, readily accessible national learning we would need to have some commonality. So our question really to you today was, would you sign up to supporting some kind of consistency in how the learning is presented in SARS? And what do you think would enable that broad sign-up? Because without it, there isn't much point in having a national library, or its use will be very limited. Yeah, so we were interested in your ideas of that. Comment, put your thoughts in the chat, email us afterwards, we're running out of time. But that's the key thing that we're going to be picking up with the Independent Chairs Network, with all the national networks, and was a key topic in the workshops.
And just picking up on the sustainability and funding point again, I mean, we'd be really keen to provide a strong case of what work might be needed in phase 2. So we've been collating all of the ideas which are currently out of scope, like going backwards in time to make sure that key serious case reviews are put into the library too. Do let us know what things you would want to see in phase 2, and we can present the evidence for more money, basically, to the people that have it. So, although that's not many people right now, but anyway, we can try our best. Indeed. At least.
And Luke, yes, sorry, my self-serving is probably, it couldn't be pure. There might need to be some checks on the way, but aiming to keep them as minimal as possible.
Okay.
Right, in the last 2 minutes, just a small word on the quality markers. Someone's mentioned that in all of this work, it's really key. We're trying to be informed by work that's been done in children's, but absolutely make sure that whatever's done is absolutely fitting for adults and not just based on the children's work. And the quality markers are one such example. So the quality markers were designed, created in the children's serious case review world with money from the Department for Education. They're meant to be a commissioning tool, a tool to support reviewers as well in the conduct of reviews. They're based on the NICE quality standards model. They've broken down into 3 kind of areas: setting up the review, running the review, and the review outputs and action taken. And they start with a quality statement of what does good look like. They have a series of questions to help you think about how you'd know whether you're meeting the quality marker or not. There are a series of questions because most of these things require judgment. It's certainly not a handbook of how to do it because it's never that straightforward, it seems. And we try to make very clear what the evidence base is of how good is articulated. The Pan-London SABS, how do they call themselves? The Pan-London Safeguarding Adult Boards network had already seen the potential relevance of the children's quality markers for adult SARS, and it's done the first piece of work of looking at all the quality statements to see how they'd need to be amended to suit the adult safeguarding context. And as part of this project, we're inheriting what London have done and are fleshing that out a bit more. So that's in process at the moment, and we will, in the next, I can't remember our deadline, shortly, there will be a revised version that, again, we do hope we will consult widely on and be very keen to hear your feedback, because, again, like the library, unless there is broad sign up to the quality markers, they aren't going to be very much use or help very much in getting better quality and use of SARS. So if you're particularly interested in that, do get in touch. We've got a smallish reference group of people who are interested to be the sort of first ports of call for checking things out. So get in touch with us if that sounds like you. Otherwise, they will be available when we've got a first draft of the amended ones for adults.
Great. So lastly, next steps then. So we're currently in Q2, just about clinging on. We've just done the last of our 3 learning events. Our next stage will be to collate and digest all the feedback that we've got from all of those colleagues who've provided that, and we've also got a pretty steady steady stream of SARs being sent in to us, which is really, really helpful. We'll be sending out a list of SARs that we've got now. Please do let us know if we've missed your SAR and send us that SAR if you can. We can either put it into the library once that's launched, or just review the SAR as part of our collation of quality and learning. So do let us know if you'd rather it isn't shared more broadly. And lastly, in Q4 we'll be doing a webinar which just sort of draws in the findings and the shape of the resource that we've produced. And between now and then, like Sheila mentioned, we'll be doing consultation on the various strands of work. So please do send us your SARs. Many thanks for coming along and being so engaged too. It's been really, really helpful. And yeah, do get in touch with us with any other questions. Yeah, it'd be great to stay in touch. Many thanks. And yeah, we'll stay here for the next sort of 10 minutes or so, just to answer any other questions. But yeah, thank you again, and we'll close there, just 1 minute late, which isn't bad going.
Not bad going. Thank you very much, everybody.
Thank
Bye.
you.